It's one of those uncomfortable and embarrassing conditions, but we all suffer from it at some point. Advice on how to treat and prevent diarrhoea, coming up on today's Health and Wellbeing. Hello and welcome to the show. I'm Liz Spate. Now, it's a subject that most of us don't want to discuss, although about 20 million adults in the UK will have suffered from diarrhoea in the past 6 months. The most surprising thing is that nearly 2/3 of sufferers don't treat their symptoms. Well, I'm joined today by health expert Dr. Christian Jessen. Welcome along, Christian. Hi. And also Jackie Bell, a patient with personal experience of the problem. Thanks to you both for coming in. Nice to see you today, Jackie. Now, coming up on today's show, confronting the problem, causes of diarrhoea and who suffers, and treatment options and preventing diarrhoea. We'll also be tackling some of those common myths. Is it better to treat diarrhoea or should you let it simply run its course? Now, Dr. Jessen, before we start, I think it would help to explain what exactly happens when you suffer from diarrhoea. Let's take a look at this short video which shows what happens to the digestive system during a bout of diarrhoea. Could you just talk us through what's actually happening to the gut here?
Absolutely. What you can see is an image of your gut there with poo passing through as it does quite normally. The muscles in the gut wall help move that poo along at a certain rate, but also the reason your gut is so long is because water is absorbed from the stool. When things go wrong and not as much water is absorbed into the gut wall, actually it remains in the stool, which of course you can imagine makes it watery, makes it loose, makes it pass out rather quickly, gives you all the symptoms of diarrhoea. Also, if the muscles work in overtime and start squeezing and pushing things through too quickly, that can give you the feeling of the cramps that you get with diarrhoea as well.
Right, okay, so there's a lot going on in there, isn't there?
Yeah, there is.
But what exactly causes diarrhoea in the first place? Generally, a lot of different causes actually, aren't there?
Actually, there are. There's a whole host of causes, but more commonly, I think everyone always thinks of infectious causes. So the bacteria, the bugs that you get on holiday, traveller's diarrhoea, parasites, but actually also food intolerances and allergies can give you diarrhoea. Right. Stress is probably one of the more important causes. When you're nervous, we all know if you perform and you get nervous about something,
just
you can
before
actually,
your exams or
yes,
something.
you can start to get loose stools. We all know about the dreaded curries. Certain foods, spicy foods can do it. Alcohol can do it. Interestingly, women just before their periods can also start to develop diarrhoea because of the hormonal changes in them. So there's a whole host of different causes.
Lots of different things going on. And why do so many people believe that it should be left to run its course without treating it?
I think there's a number of myths. I think, first of all, when you read about diarrhoea, you tend to read about more extreme cases and those awful bacterial causes, Salmonella, Campylobacter, cholera, and usually those probably are best either to be treated with antibiotics or to be left to run its course. But generally, that sort of stress diarrhoea, actually, you do need to treat. But if you're like most people, working, running about, got things to do, then actually treating it is going to be the best way to get on with your life.
And what about children? If you don't treat a child and they've got diarrhoea, it could be quite dangerous, could it?
Well, I think the most important thing with children really is to make sure they're getting the fluids up. It's important with everybody, but particularly with children, they're not very good at going and make sure they're drinking enough. So making sure your child is really well hydrated, because remember, you're losing a lot of fluid with the diarrhoea, is key to keeping your child healthy. Okay,
well, Jackie, let's bring you in here. Thanks so much for coming in. I know it's a bit of an embarrassing topic to talk about, really, isn't it? But how long have you been suffering with diarrhoea?
For about the last 10 years.
Right.
As you say, it is very stress related. If anything upsets me, it goes straight to my stomach. Right. I get terrible cramps. I feel like I've been punched from the inside out, and it can be very, very embarrassing at times. At home, I can manage it quite happily, but if I'm out, I find it very, very embarrassing, and I have to then take pills to try and stop it.
Yeah. So do you think yours is sort of an irritable bowel response?
Quite possibly, yes. I actually went to my pharmacist and he recommended me some pills which I take, and they seem to do the job when I have a bout. If I'm in company or in somebody's house, and they calm it all the way down. It takes away the cramps, and it does help it a lot.
Yeah. And do you find it difficult to talk about with your family or friends?
Not with my family and not with my very good friends.
Yeah.
In fact, I have been known to phone one up as I've been en route up the motorway and say, can I come in and use your toilet, please? But not so close friends, yes, I would find it very embarrassing.
Yes. And what about your GP?
It's not the sort of thing I would want to go and talk to him about. If I'd have a lady GP, I might feel happier, but I was quite happy speaking to the pharmacist. He gave me these pills and they seemed to do the job.
And does it actually affect the way that you live your life?
Yes and no. I can't find any food that upsets me.
Right.
I carry the pills around with me the whole time, so that if it suddenly happens and I'm out, I've got pills to take. But I try and keep my life going as it should go. I don't want it to disrupt my life.
No. So you're obviously taking these pills.
Yes.
Christian, what sort of treatments are there out there? There's quite a wide range of things you can do.
You can really divide them into two main things. The most important thing probably is rehydration. So if you've got a lot of diarrhoea, you need to replace those fluids. Yes. Dehydration will make you more and more ill, make you feel worse and worse. So absolutely drinking, and really anything. People argue about whether fruit juice or milk is the right thing. I'd say any fluid is important to get in.
Particularly with children, I suppose. Just try and get as much as you can in.
You can start getting fussy. You can have things like oral rehydration solution, which is sort of salt and sugar mixtures that you dissolve in water, but really any fluids, get them in. And then you get over-the-counter medications like loperamide, which really calms the gut down and helps slow things down, helps a bit more water be absorbed so that the stools are not so loose, and really, as you say, can help relieve the symptoms of diarrhoea and help you get on with your day. So treatments are available. I'd say if you have bad cramps, high fevers, blood or mucus with the diarrhoea, then it's probably more likely that you have a nasty infectious cause and you must go and see your GP, because perhaps antibiotics would be right for you.
Okay, so that's sort of a worst case scenario then, antibiotics.
It is, but it's a rarer cause. I think most of us, things like stress related diarrhoea is probably more common, and so an over-the-counter treatment will be absolutely suitable.
Yeah. So how do you prevent yourself from getting diarrhoea in the first place? I mean, can you prevent yourself from picking up bugs and that sort of thing?
Well, obviously good hygiene, washing hands, being careful about the sources of your food and where your water comes from, particularly on holiday, is absolutely imperative. In Jackie's case, it's probably very difficult, isn't it? I mean, you don't know exactly what sets it off.
I can't say there's a certain food that sets it off. If I do, as I say, if I do get stressed, it will go to my stomach first of all. But I can't pinpoint an actual thing.
So with you, I think just being prepared, having the medication with you when you need it. If you're a woman who maybe suffers diarrhoea before her period, then you know almost to the day what time you need to start taking your medication to make sure that it disrupts your life as little as possible. So there's various things you can do. Obviously spicy foods and alcohol, if you know they upset you, that you need to avoid them. If you are intolerant to certain foods, you need to avoid those as well.
Now, some people think that if you take diarrhoea tablets, it sort of somehow bungs you up and stops any bugs that you've got coming out of your system. Is that right?
Well, it is a very common myth that I hear a lot, and I would say, as we said before, if you have high fevers, cramps, blood or mucus coming out, then actually go and seek medical advice first before you take anything yourself. But for that short-lived acute diarrhoea, where it's just the diarrhoea and maybe a bit of cramping, no, it's not right at all, and it'll absolutely help you get on with your life, stop you living in the bathroom for 3 days, and it will relieve the symptoms, make you feel a lot more comfortable, won't it? So no, it's fine to take medication.
And how long should you wait before seeking advice? How long were you sort of suffering before you went to a pharmacist?
Maybe 2 or 3 weeks.
Right.
Because at that time I was getting it the whole time.
Oh right, yeah.
But now I have about maybe every 10 days, 2 weeks, and I can more or less tell when it's going to happen.
Right. So what sets it off? Sort of stress, anxiety, that sort of thing?
If I get upset, if anything upsets me, that will set it off. It can be for no reason at all also, just something will go in my stomach and say, right, I'm going to make you want to sit on the toilet for a long time.
In Jackie's case, I mean, she knows absolutely what it is, where it comes from, what's going to set it off, and that's fine. So I'd say she doesn't really need to seek medical advice now.
But she's managing it really well, aren't you? Which is good.
I think if you have really your first bout of diarrhoea or a bout of diarrhoea after a long period of normal bowel movements, anything lasting longer than about 3 days, I would always say, look, just seek advice. Check there's nothing else going on that can be dealt with as well. Okay.
Well, that's just about all we've got time for. But before we go, top tip from both of you. Jackie, what would you say?
Carry some pills along with you, and always have a bottle of water with you, which I always do. And I also know if I'm going out, I try and know where the toilets are.
Good tip. Always look for the loo.
Gosh, you've done all the good ones. You haven't left me any. I mean, I was going to say actually just be prepared. You know, just always have something at least at home, and don't underestimate how quickly diarrhoea can dehydrate you.
Right.
Particularly if you're in a warm country or it's summer, say in this country. Yes. It's simple. Just make sure you're getting plenty of fluids on board.
Yes, and treat it. Don't be afraid to treat your symptoms. Absolutely. Okay. Well, that's all we have time for today. My thanks to Dr. Christian Jessen and Jackie for joining me, for all your advice. Thanks for watching. We'll see you next time. Bye-bye.